the following, and I quote, "We should not be giving black people the same vaccine schedule that's given to whites." Because can you please explain what you meant?
There's a series of studies, I think most of them by...
Dude.
If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
You're a smart guy. You're reading the medical literature, and you're coming up with the recent medical literature on certain issues.
Grounded TV.
And one of the things that was most disturbing to me about yesterday's hearing was the suggestion from some of my friends on the other side of the dais that our intense questioning and concerns about Mr. Kennedy were driven by partisanship. I have voted for 5 of President Trump's nominees to date in the last couple of weeks. One of them, the new Secretary of Transportation, was on the scene last night at DCA. Like all of us, I take really seriously our obligation for advice and consent. And I am concerned, as Senator Mullen expressed his concern, about the need for science to help us move forward on critical issues. Now, some of you are new to this committee and new to the Senate, so you may not know that I am the proud mother of a 36-year-old young man with severe cerebral palsy. And a day does not go by when I don't think about what did I do when I was pregnant with him that might have caused the hydrocephalus that has so impacted his life. So please do not suggest that anybody in this body of either political party doesn't want to know what the cause of autism is. Do you know how many friends I have with children who have autism? The problem with this witness's response on the autism cause and the relationship to vaccines is because he's relitigating and churning settled science so we can't go forward and find out what the cause of autism is and treat these kids and help these families. Mr. Kennedy, that first autism study rocked my world. And like every mother, I worried about whether, in fact, the vaccine had done something to my son. And you know what? It was a tiny study of about 12 kids. And over time, the scientific community studied and studied and studied and found that it was wrong. And the journal retracted.
Yeah, she's right. Like, it's a waste of resources, right? To keep on relitigating the same thing if it's already settled science.
We build on the work and we become more successful. And when you continue to sow doubt about settled science, it makes it impossible for us to move forward. So that's what the problem is here. It's the relitigating and rehashing and continuing to sow doubt so we can't move forward, and it freezes us in place. Now let me move on to my other concerns from yesterday's hearing. During yesterday's hearing, you really showed a lack of knowledge about Medicare and Medicaid. So what is Medicare Part A?
Medicare Part A pays mainly for primary care or physicians, and then Medicare.
No, so it is about, Medicare Part A is seniors coverage for inpatient hospital care. What's Medicare Part B?
For physicians and doctors. Medicare Part D.
That is coverage for outpatient care and home health. So what is Medicare Part C?
Medicare Part C is a program where it's the full menu of all the services, A, B, C, and D for Medicare.
It is Medicare.
One other thing is you and I talked about red dye number 3, and just happened, you and I talked about that, and a few days later in this room we had the FDA director. And I asked him, Why do we use red dye 3 in our cosmetics?
Yeah, no, I know it is, Rob, but this is what I was saying with it is that the way that a couple of different senators are painting it is like they're getting 72 different shots, right? They're not saying an exact number. Like, I don't want to become a pincushion, like 72 different vaccines. Like, it's like they're saying certain words.
Yeah, it's the
and
number
painting this
itself.
Horrible picture.
It's like
of 72 different needles, I feel like. And that's just.
You're focusing on the wrong part of it, right? Because if there was issues with the vaccine, it's not the number of them that's the problem.
No. And I know everyone in the chat's correcting me. It's like, yeah, I do understand it. And I think they do too. It's just the way that they're selling it. It sounds worse than it is.
Or we don't use in
If someone had no idea about this, I imagine most people understand, but
cosmetics. We use in our food, but we don't use it in cosmetics because it causes cancer. What in the heck's going on? Well, a few weeks later, because
it's probably concentration levels.
We dropped it. So tell me about dyes and things that you're.
Well, putting it on your skin is different from eating it.
Yeah, and the concentration that you would have to use to make something actually colored red, like for lipstick or something, would probably be a lot higher.
There's tons of stuff that's like for your skin that says "do not ingest," "do not get in your eyes," right? Like for reasons.
Yeah.
I get more talk about that than anything.
We have 10,000.
Yeah, and like you can eat fried chicken, but you probably shouldn't rub it on your skin.
Okay, that one's just speculation.
I'm just saying here.
FDA employs a standard called the GRAS standard and looks at any new chemical as innocent until proven guilty. In Europe, they have 400 ingredients in their foods. Kellogg's makes Fruit Loops for the United States alone. It is loaded with red dye, blue dye, yellow dye, and many, many other ingredients. They make the same product for Canada that's all vegetable dyes, and for Europe. If you eat
this is fine. I actually agree with him here. Like having a few more restrictions on the food, that's fine.
But that's what I mean.
Lowering the amount of sugar,
focused on the vaccine stuff.
Good rules, but
that's why I said.
But it's because that's his. Why elect a guy that's so ignorant about the system?
No, but anyone who's not focused, I wouldn't call it ignorant. I would say untrusting.
I would say he's ignorant. I'd say he hasn't done a lot of
untrusting. I wouldn't say ignorant. He seems like a pretty educated.
No, I'm
dude.
saying about the thing because they were asking him questions about the different branches that he's going to be in charge of, and he doesn't even know the answers. He is ignorant. He's ignorant about the job. He's ignorant about studies that he's saying he needs to look into that he hasn't done, even though he's spoken on them over and over and over again. He hasn't done any he hasn't actually read them. He doesn't know about them. You know, if he was actually able to cite the studies and say what his issues were with them, that'd be different.
Some of the studies are locked up and he cannot access them.
No, he said there was some data that was locked out of independent researchers or whatever, right?
No, from the CDC data. That was
just one specific point of view.
Yeah, but I'm just saying.
Good morning. Thank you, Mr. Chair. Mr. Kennedy, I was struck by your comments during our meeting last week.
What?
I was struck by your comments in our meeting last week where you made it abundantly clear to me that you intended to clean house of the professional scientist at the National Institutes of Health, which you know is headquartered in the state of Maryland and employs thousands of hardworking Marylanders. I, for the record, believe in scientists, and I believe in doctors, and I trust them over politicians without medical degrees. You talked about bad science and bad scientists, and in fact, you specifically said to me in response to my question that you intend to replace the bad scientist with the good scientist. And so I want to ask you, in your opinion, what makes a scientist or a doctor qualified to serve at the National Institutes of Health?
That's a good question.
Science who's devoted to empirical methodology, to evidence-based science, scientists who understand the importance of replication, the importance of publishing raw data and being open and transparent about it, the importance of publishing peer review. We have, NIH has overseen over the past several years the precipitous decline in American health. There's 91,000 people at HHS, and are you suggesting that some of them should not be held responsible for that decline? They were in charge of protecting our health.
Let me just insert here.
Let me just finish.
Let me just say this, because I only have 3 minutes left. I don't set the rules here, but I ask the questions. And the question is really whether you intend, as you said, to substitute essentially your judgment for the judgment of these professional scientists. And
I'm not going to substitute my judgment for science. Of course, I'm not going to do that. What I'm going to do, Listen, the New York Times just did an article last week talking about the fraud, the 20-year fraud, 800 fraudulent studies produced by NIH on amyloid plaques and not allowing any other
He keeps calling them blacks, and I'm like, dude, like, how old are you? he's almost 70. Like, why not just say African American? Like, you're in such a politically heavy area. It's so funny. No one's acknowledging it this whole time. It's like the 10th time he said it, and you can see the one
Trump does it too.
The
So
one
it's
cop in
just
the
like,
back flinched the first time he said it. I just think it's funny. I don't know. Because like I said, I don't know. Maybe if
Cheryl's, like,
you're
slumping
African
in her
American
chair.
and you're offended, let me know. I don't think it's that. Like, I don't think he's racist because of it. I just think it's funny. Like, he's like, you know, just he is almost 70.
I think it's funny too. Yeah.
but the hypothesis about the cause of Alzheimer's.
Well, how
to be
will you
explored.
decide, Mr. Kennedy, which scientists
The
are
ones who
bad
are-
scientists?
the ones
Are they the ones who disagree with you?
The ones who are corrupt, the ones who have been doing
True.
science like the amyloid plaque studies that were fraudulent.
Well,
We
these
should
doctors,
not.
let me ask you a question. Do you have a medical degree?
Do I know?
Okay, let me
Oh,
go to the next
jeez.
question. The Heritage Fund has compiled a watch list of
I'm not a
federal
biologist
employees
either.
to go after federal staff. Is there a watch list for federal staff at HHS?
Not that I know of.
Have you or has anyone in the administration developed a list of career scientists or federal staff that you would target for termination?
Not that I know of.
And let me just ask you another question. Now, your failed presidential campaign has been raising money to try and cover your debts. And you were questioned about this yesterday and failed to answer a question that Senator Warren asked you. And so I want to ask you again regarding these emails that you have sent to raise money. How much has your presidential campaign made fundraising off of this administration's complete disregard for the workforce at HHS?
Excuse me? I didn't hear the question. The last part.
How much money has your presidential campaign made off of fundraising, off of this administration's complete disregard for the workforce at HHS?
Zero.
Okay, Mr. Chair, I'd like to ask unanimous consent to enter into the record 2 emails from this week and the week before regarding fundraising that you're currently doing through your presidential campaign.
Without objection.
Jeez.
And finally, I want to ask you, I have you said you were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by
Dude, oh my God.
that show that to particular antigens that blacks have a
See,
much
the thing is, he broke it down by the generic groups of America. You know, like certain America, like everyone can be broken down in main groups of descent, whether you're European descent, Latin America, Latin descent, or African descent, right? And it's just funny. He put it on tweets. How do you walk your way out of this one?
Dude, it's just
it sounds
like,
so
why?
bad. It
Why-
sounds so
What are you
bad.
doing?
Like, it just
It's
sounds really bad. But like, I don't
pretty
know.
rough, yeah.
Honestly, the thing is, though, it is hard to talk about. Like, there is slight varying degrees sometimes depending on your ethnic background. It's not just isolated to skin color.
Yeah, but it's not just that, right? Like it's more than there's more factors you need to take account of.
But clearly, he's just saying a lot of the time, and it's biting his butt right
I
now.
agree.
much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Pollen article suggests that blacks need fewer antigens than
This is so
Okay.
Mr. Kennedy, with all due respect, that is
Buddy.
so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will
Was
be
the
voting
truth
against
is
your nomination
it's
because
science.
your views are dangerous to our state and to our country.
I don't think they're
I mean, do you think
dangerous.
science is dangerous, Senator?
Oh,
This is published peer-reviewed studies.
I yield.
yeah. I agree. You can't just dismiss it because it
Blacks
sounds
is
racist.
way too broad of a no. It's blacks is way too broad of a group, right? There's so many different types of black people. There's like more genetic diversity, I think, in Africa than anywhere else in the world.
Now, you're a smart guy. You're reading the medical literature, and you're coming up with the recent medical literature on certain issues. But here is both older article summarizing lots of older articles that have come out since the original refuted Wakefield article in The Lancet regarding measles and autism. And here is somebody who, you know, it's he said, she said, but somebody who said that previously you've had this presented to you. So back to me. I'm a doc trying to understand. Convince me that you will become the public health advocate, but not just churn old information so that there's never a conclusion, as Senator Hassan suggested, but that will become the influencer for people to believe, no, there's 1.25 million kids studied and there's no autism associated with measles. You tell me, you see what my question is in there.
And that's a pretty good question, I think. And this is what I'm talking about. It's like we do need to be mindful that in certain aspects of some of the claims he has made have been proven wrong.
Senator, I'm going to be an advocate for strong science. You show me those scientific studies, and you and I can meet about it. And there are other studies as well, and I'd love to show those to you. There's a study that came out last week of 47,000 9-year-olds in the Medicaid system in Florida by I think a Louisiana scientist called Mawson that shows the opposite. So there are other studies out there. I just want to follow the science. And I will do, if the science says that I am wrong about what I've said in the past, as I said, I will publicly apologize. There's many times I've been wrong about science. If you look at my Instagram account, when I'm wrong, I apologize for it. And I say I was wrong. I don't have any problem. Science is a process of challenging hypotheses with new evidence. And scientists have to be able to admit when they're wrong. Epidemiological studies, the Institute of Medicine has said repeatedly in 2013, 2017, when they investigated this, has asked CDC to do certain studies, animal studies, bench studies, observational studies, studies of the vaccine safety data link. CDC has not done that. Oh, I want them to do that, and I want the best science. I can guarantee you, on my word of honor, and if you show me science that says that I'm wrong, I'm going to say I was wrong. I don't have any problem. There's nothing that would make me happier. We need to be able to look at the science and get IOM involved, the National Academy of Sciences. They're the ultimate arbiter of safety.
What was that?
And one of the things we need to do, I think, is a subject that we haven't talked about here. Why don't we know what's causing this epidemic? Why hasn't the CDC been looking at other hypotheses to determine the etiology of why we've had this dramatic 1,000% increase in this disease that is destroying our kids? It's probably the biggest issue. Why don't we know the answer after 30 years of steady rises in autism rates? Why don't we know the answer to that? We should know the answer.
What was that? What was that last article? Did you mention?
That article is by Mawson, M-A-W-S-O-N.
And it's regarding measles and what?
No, it looks at the entire schedule, and it says it's a study of 9-year-old boys, 47,000 9-year-old boys from the Florida healthcare data.
Okay, let me, Senator Sanders.
Bernie's still there.
I find myself in the unusual and uncomfortable position of having to agree with Senator Cassidy's line of questioning.
He's just such like a cartoonish character, Bernie. The way he talks.
Mr. Kennedy, in an interview in July 2023, you stated, quote, I do believe autism does come
It reminds me of Larry David. You know what I mean? Like from Curb Your
Yeah.
Enthusiasm. Like just talks the same way. They got similar accents and everything.
from vaccines.
Yeah, Larry David did
And you
impersonated
have
him on
the end of
SNL.
quote, and you have praised
Oh, really?
a
Yeah,
gentleman
look that
named
up.
Andrew Wakefield for his research. What studies, you talk about the need to be science-based, to get our information, good information to make decisions. What studies have you utilized to come to the conclusion that vaccines cause autism?
I'm happy to sit down with you.
No, please, just answer me that.
Well, I mean, look at the Mawson study, Senator.
The what?
Thank you.
Mawson, just look at that study.
Yeah, I will, and that was published.
But I don't want to, I wouldn't rest on a single study.
Right.
And all studies can be
Okay,
methodology.
don't mean to be rude, I don't have a lot of time.
Just saying
You would not be, I just heard you say you could not be happier if you were proved wrong. Mr. Chairman, I asked to put into the record 16 studies done by scientists and doctors all over the world saying that vaccines do not cause autism. Are you happy with that objection?
The IOM assessment of the 16 study, Senator.
Are you
The
happy?
IOM has assessment. But listen,
Let me get to it. Don't have a lot of time. I apologize. I'm happy to talk to you at another time. Don't have a lot of
It's
time.
just like his Googled first.
Let's talk about COVID.
It's like he didn't really show the page. It's like the first page of Google results or something. I wish he'd show more elaborate, have big cards like the other guys had.
A big card, yeah.
Yeah.
And I just want clarity on the issue. And again, I apologize. You have
There's
to
not
be
very much
brief.
clarity,
We don't have a
Bernie.
lot of time.
You couldn't read the paper.
Scientists have estimated that the COVID vaccine saved 3 million lives. President Trump said the COVID vaccine was, quote, one of the great miracles of the ages, end quote. You have said the COVID vaccine was the deadliest vaccine ever made, end of quote. Was the COVID vaccine the deadliest vaccine
That's
ever
not
made?
true.
the reason I said that, Senator Sanders, is because
Way worse recorded
there were more
disasters with
reports on the VAERS
those
system, on
things.
the vaccine adverse event reporting system, which is the only surveillance system, that and VSafe. And there were more reports of injuries and deaths than all other vaccines combined.
But was it the scientists said it saved 3 million
According to
lives?
VAERS, I don't know, because we don't have a good surveillance system. So
So
nobody
you
can answer
disagree
that
with the
question.
scientific community that,
Oh, I'm agnostic because we don't have the science to make that determination.
really, okay. Prescription drug prices in America, as you know,
And by the way, I think President Trump did an extraordinary job on warp speed because he wasn't just focusing on that
See ya,
one
Turdo.
intervention. He was focusing
he
on
called it a
all
miracle, but you have cast doubts on its efficacy. All right, prescription drugs. If we're going to make America healthy, I agree with you that we need a revolution in the nature of food in America, physical exercise, et cetera, very, very important. But there are people who are going to get sick, and they have to go to the doctor and find out why.
Okay, you know, Bernie Sanders was born in 1941, so he's 84 this
Yeah.
year. Jeez.
Yeah, he's an old man.
1 out of 4 Americans today cannot afford the prescription drugs their doctors prescribe
He was born during World War II.
because we pay by far the highest prices in the world for prescription drugs. We made some
Guess so was
progress
Trump.
under the Biden administration of negotiating prescription drug prices with pharma. First time that's ever happened. Now, yesterday you told me that the White House was going to issue something.
What was
affirming
so is
its
Trump?
support for continuing
Born in the 40s.
Oh, yeah.
those Medicare negotiations. Turned out not to be quite accurate. They came up with some bland statement, could have been written by pharma. Very specific questions. Do you believe and
Is it
will you
specific?
insist that Medicare continue to negotiate prices with the pharmaceutical industry so we can substantially lower prescription drug costs in America?
President Trump has made it very clear to me that he wants to negotiate.
Negotiate is a big word, Bobby. It's a big word.
It's the word you just used, Senator.
Yeah, but no, I use defend a particular law. Will you defend the law in the Inflation Reduction Act, which already is negotiating
A
prescription
little
drug
cross-eyed there.
President Trump wants us to negotiate drug price. He wants to
But you're
lower
not-
drug prices.
So you're not telling me that you will defend the law that we passed, which has already had significant success.
Well, Congress, look, I'm going to comply with the law, Senator. Congress passed the law. I'm swearing an oath to the Constitution. I'm going to comply
You're
with the
going to have a
laws.
significant influence on healthcare policy if you are.
And I'm going to comply with the laws.
Let me just say this in conclusion, Chairman Cassidy. President Trump and Mr. Kennedy are quite right when they say that our system is broken. They're right. Our economic system today is broken. 3 people own more wealth than the bottom half of American society. Wages have been stagnant for American workers for 50 years. The economy is broken. You know what? Our political system is broken and corrupt. You have a handful of billionaires in both political parties who contribute
He does
huge
sound like
amounts of
Charlie
money
Angus.
to elect candidates in this room throughout the United States Congress. That is a broken political system and a real threat to democracy. Our healthcare system is broken. And it's broken for some of the reasons that Mr. Kennedy indicated. We have not paid attention to the fact that we have massive amounts of chronic disease. We have not answered the question why in the richest country in the history of the world, our life expectancy is lower than it is in countries far poorer than we are. So I think in many ways, President Trump and Mr. Kennedy have asked some of the right questions. Problem is their answers will only make a bad situation worse. So let me
Goes from normal to just yelling full volume.
ask Mr. Kennedy again. If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
Not every other single country does that, Bernie.
I'm going to make America
Every other
healthier
single
than
what?
other
Which
countries in
country?
the world right now.
He said every other single country. It's not. It's not. There's a small handful of
Did
countries
you
that
say
have.
first world country?
No, he just said world. He just said countries. He just said countries.
Can you just rewind it a little bit? Just can hear that.
Country on earth does, guarantee people that you will fight to do what every other major country on earth does, guarantee
Oh, major
healthcare
country.
to
Okay.
Okay,
every
fine.
single
Well, it sounded like
American.
country.
I'm going to make America healthier than other countries in the world right now.
Will
we're
you
the sickest.
guarantee do what every other major country does? It's a simple question.
It's like, shut up, Bernie.
Bernie.
Called him
The problem of corruption is not just in
He
the
didn't call him Senator Sanders. He's called him Bernie.
federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry.
What? Yeah, Rob's been posting some links in the Discord this whole time about
Bernie
it.
Sanders is taking money
Apparently,
from the
$1.4 million
industry.
just in like a year. Apparently.
Okay.
Oh, I thought that would no. I ran for president like you. I got millions
I know.
and millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical industry.
Okay, Rob just posted a screenshot. Never mind, but it's apparently 1.4 million. Rob, if you want to get us
PAC
put some
money, right?
links and some
For
sources,
not PAC money?
then we can figure it out
dude.
on our own without just a screenshot.
They came from workers.
You can also look it up too.
In 2020, you were the single largest
Because I had
receiver of
small
pharmaceutical money.
contributions
Yeah, it was people who
from
worked at those
workers all
companies.
over
It's
this
not
country.
from the
Workers,
actual
you were the
corporate
not
corporations.
a nickel from corporate
Bernie,
tax.
you were the single largest acceptor of
workers.
pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right, but you have not answered. Last question. You have not answered my question.
Mr. Chairman, we're 3 minutes.
We can look into it too.
How do we make America healthy if you don't guarantee health
Chairman,
care
we're
to all
literally
people?
3 minutes over
This is
here.
kind
now.
of funny.
How long does it keep
Oh,
going?
so he doesn't have to
Sometimes
answer the
you're just
question
battering the
either, eh?
witness,
Not
Bernie.
battering the witness.
Yes, you are.
Just
And
battering the
you're getting
witness. Oh,
upset
my
at him, You're
God.
going at him just like anybody else would.